A riot has broken out in a prison in Argentina after a COVID-19 case was confirmed inside. Hundreds of millions of Muslims begin to mark the month of Ramadan amid COVID-19 restrictions. Health experts warn that COVID-19 could reverse gains made against malaria in Africa. Hello and welcome to Telesur. I'm Carla Gonzalez and this is from the South. A prison riot has broken in Argentina after inmates at the Villa Devoto prison in Buenos Aires demanded measures to contain COVID-19 infections. Our correspondent Juan Carlos Bartolota has more.
The Villa Devoto neighborhood in the capital is practically taken by the police after a prison riot broke out in this facility. Several parts of the prison have been taken by the inmates, and we can see a large presence of security guards. Today, it was announced that a security guard had tested positive for COVID-19. Prisoners are now demanding better conditions. Some want to be transferred to other prisons or to comply with their sentences from their homes. They say health conditions are not assured inside the prison.
That was Juan Carlos Bartolota from Buenos Aires. The Venezuelan Vice President of Communication, Jorge Rodriguez, announced new cases of COVID-19 were detected in the country, taking the total to 318.
Today, we have to report 7 new cases of COVID-19 infections in Venezuela. 4 are women and 3 are men. The state of Nueva Esparta continues to be an infection focus with 4 cases, 3 cases in the state of Táchira, but the person resides in the state of Yaracuy. From the 318 cases in Venezuela right now, we have 5 more people that have recovered. Now, we have 128 recovered cases, which are 40%. 95 of those are inside public hospitals, 27 in private clinics, and 10 people, unfortunately, have died.
The Mexican Health Ministry reported this Friday that the country has now registered over 1,000 COVID-19 deaths, adding that the peak of the epidemic is yet to come. This comes 2 days after the authorities raised the level of alert due to an accelerated increase in cases, raising fears that the hospital system could become swamped. The federal government suspended all non-essential activities until May 30th and called on the population to stay at home, although it did not decree a mandatory quarantine. Mexico has more than 11,000 confirmed COVID-19 cases.
We will continue to have more and more cases of illness, people requiring hospitalization, and also critically ill people until we reach the peak of this epidemic.
Thousands of residents of the Peruvian capital, Lima, have abandoned the city and headed for other provinces to escape the economic crisis aggravated by the COVID-19 pandemic. The absence of employment opportunities, the high percentage of informal jobs, as well as the collapse of the health system have seen Peruvians move to inland areas. The lockdown started on March 16th and has led to increasing poverty. Peru is the second most affected by the coronavirus in Latin America, with almost 20,000 cases and over 500 deaths. With the number of cases rising, the quarantine was extended yesterday until May 10th. And at least 1,300 officers of the Peruvian National Police have been infected by the novel coronavirus. Interior Minister Carlos Moran said that out of the 24,000 COVID-19 tests that were conducted on members of the police, 1,300 came back positive. The minister noted that the police force is made up of 130,000 officers and that the Ministry of Health will undertake 200,000 more tests. Out of the 572 people killed by COVID-19 in Peru, at least 9 were police officers. The government of Ecuador announced there were about 11,000 cases of COVID-19, but the Minister of Health said it was double that figure just hours after. The Minister of Health, Juan Carlos Zeballos, announced that the country has 22,160 cases. He said this was due to more than 20,000 test results that had been delayed. 50% of those tested were announced infected, and the minister said this was an outcome expected. Prefects across Ecuador have spoken out about the difficulties they face in responding to COVID-19. We have more in this report.
During his first month as health minister, Juan Zeballos has said that all pertinent measures are being taken to confront the pandemic. One of his announcements is that there will be no more delays in the testing process.
We have pushed for private laboratories and universities to conduct these tests. We are careful checking whether the labs have the correct equipment and are reporting the results. We have started to take samples across different areas so we can have an idea of current infection rates.
The prefect of Guayas province said the collapse of healthcare systems in the province shows the lack of coordination among authorities. The current situation of lost bodies and mass graves is proof of this.
There was a time to consider a mass grave, but nobody wanted to be responsible. The government should have taken responsibility. The health minister needed to give directions to the prefect's office and the mayor of Guayaquil. It pains me to speak of a mass grave, and now we need to rebuild our country with an economy that has been destroyed.
The second most affected province is Pichincha. Although the number of deaths is lower than in other provinces, Prefect Paola Pabon has said the necessary measures were implemented on time. Nonetheless, she said the resources are limited.
The role of local governments has been key, but there is an issue with autonomous governments. We haven't received the allotted funds since January. But even without resources and with the money that is owed to us, we are working to protect our citizens. We have helped 6,000 families in need, and our goal is to reach 16,000.
His part, the mayor of Quito, Jorge Yunda, announced the arrival of the first 5,000 COVID-19 testing kits out of a total of 200,000 acquired by his office.
And now we move to Brazil, where the Justice Minister Sergio Moro has resigned due to political pressure by President Jair Bolsonaro. The reason was the dismissal of the head of the police, who was a close ally to Moro. Moro had warned about his resignation and called Bolsonaro's act political interference. Moro was known for being the judge behind the Lava Jato case, which kept former President Luiz Inácio Lula da Silva from running in the presidential elections. Moro was accused of prosecuting Lula without evidence. This directly benefited frontrunner Bolsonaro. And after this, Moro became Bolsonaro's Minister of Justice. Let's turn to our correspondent in Sao Paulo, Brian Meir, for more.
At 11 o'clock this morning, far-right Brazilian President Jair Bolsonaro's Justice Minister Sergio Moro held a press conference in which he announced his resignation after 1 year and 4 months of a lackluster performance in which he wasn't able to get anything substantial passed through Congress. Now, a lot of people remember Moro as this media darling who was the chief judge in Operation Car Wash, the ostensibly anti-corruption investigation which paralyzed the Brazilian economy in 2015 by shutting down the 5 biggest construction companies, causing an immediate 500,000 job layoffs, and by removing former President Luiz Inácio Lula da Silva from the presidential elections in 2018 on frivolous charges that have been revealed subsequently by The Intercept with leaked social media chat messages to have been conducted without any material evidence, and the prosecutors there was no material evidence. Now, Moro has a huge amount of support from Brazil's far right. So a lot of people are wondering what's going to happen now. It seems as if already, judging by what's happening on Twitter and on the social media today, there's a split emerging in the Brazilian right between supporters of Moro and supporters of Bolsonaro. Now, during his press conference, he hinted that Bolsonaro had committed a series of crimes and that he had evidence of this. And this has piqued the interest of the Supreme Court. There's already 24 impeachment requests against Bolsonaro, so it looks like Moro's actions today might result in a few more impeachment requests. The question is, does Congressional President Rodrigo Maia have the courage to launch impeachment proceedings against Jair Bolsonaro?
That was a report by Brian Meir in Brazil. We'll take a short break now, but join us again in a minute. thank you for joining us again. CARICOM Chair Mia Motley has lamented the lack of assistance given to the Caribbean community by international financial institutions. Motley called for middle-income states to be given an opportunity to protect their people from the coronavirus pandemic. She praised Costa Rica's president, who called for fixed 0% interest long-term loans to be given to countries in the region. Dominica is considering relaxing its measures implemented to curb the spread of COVID-19, since the country has gone 2 weeks without recording a single new case. The total number of positives remains at 16. The active cases are 7, recoveries 9, and no deaths.
There's a delicate balance, and we're assessing the situation on a daily basis, because there's a very thin line between success and failure as regards to COVID-19. One wrong move and we are back to square one. Bear with the Ministry of Health and the government of Dominica, by extension, while we assess and review the restrictive measures in place. Your continued effort and discipline will give us more reason to adjust the time restrictions which have been put in place. But when we do, and more freedom is granted, it is not open season. It is not a carte blanche. We must continue the measures which have brought us where we are today. I would like to thank our friendly governments of the Republic of Cuba for providing medical personnel in fighting COVID-19. This has made our job much more manageable as regards our COVID isolation unit and our district surveillance level. People's Republic of China for many supplies we've received, and for more supplies which are expected in the next couple of weeks. Also the Republic of Venezuela for medical supplies in aiding us during the COVID-19 crisis.
A group of 129 migrants deported from the United States arrived in Haiti on Thursday. This is the second such flight to arrive in the island this month, raising concerns about the country's capacity to deal with an increase in COVID-19 cases. The deportees are being housed in a hotel in Port-au-Prince, where they need to spend 14 days in quarantine. The group includes 50 children ranging in ages from 5 to 15. Haiti has so far reported 62 cases with 4 deaths.
Today we are in a difficult situation. With the outbreak of COVID-19, it's clear the Haitian government has assumed its responsibilities by choosing to quarantine these people for a period of 14 days and to follow up clinically those who are sick. And if we find anyone who is sick, we will send them to the hospital for treatment.
A 4-year-old has become Jamaica's latest COVID-19 victim, taking the country's death toll to 7. This was announced by Health Minister Christopher Tufton via Twitter on Thursday night. Jamaica recorded 14 additional positive cases in 48 hours, taking the country's total to 257. Jamaica has the most number of cases in the English-speaking Caribbean. In the Dominican Republic, street vendors say they are at the end of their rope and have no way to survive due to the measures to combat COVID-19. There's more in this report.
Informal workers are asking help from the government to survive the dramatic economic impact caused by social distancing measures imposed to control the coronavirus pandemic.
We've spent almost 15 days at home. We've spent all of our cash and we have nothing to eat anymore. The government told us to stay at home, but they gave us no aid, no food, nothing. We have started to head outside because nobody's thinking about our survival.
The National Association of Street Vendors has asked that its 2,000 members be included in the government's stay-at-home program. The program is providing aid to 1.5 million families in the form of a monthly subsidy of $95 for 2 months.
Street vendors are going through pure chaos. We have spent an entire month without work, without making a cent. We are part of the informal commerce, and as such, we live on a day-to-day basis, working today so we can eat tomorrow. Imagine our desperation, to choose to go out on the street because we are receiving no aid.
They are forced to go out on the street and expose themselves to the virus in order to bring food back to their families.
I demand the government help us. We at least need food stamps because I have no way to go on. This is why I'm out on the street. I'd like to be at home instead.
According to the Dominican Republic's central bank, informal workers make up 56% of the nation's workforce.
We have more stories coming up. We'll be right back. People in Egypt are celebrating Ramadan, despite the restrictions of the COVID-19 pandemic and a sandstorm that further clouded the first day of the month of fasting. Residents of Cairo said they are struggling to maintain high spirits this Ramadan. The Egyptian government has banned public gatherings, including prayers at mosques. The cabinet announced on Thursday that a nightly curfew will begin at 9 p.m. instead of 8 p.m. as of Friday, the first day of Ramadan. Egypt is the most affected country in the African continent, with over 4,000 confirmed COVID-19 cases and almost 300 deaths.
It is not as joyful as it is every year. What we're experiencing now is affecting us and the whole world, but we are hoping that with the blessing that comes along with this holy month and its prayers, that this pandemic will end.
The death toll from flooding in Eastern Democratic Republic of Congo has risen to 52. Local authorities said more than 100 people were injured and about 4,000 homes destroyed when a local river flooded after heavy rains. A rescue operation is underway for residents who are still missing. Victims have appealed for help from humanitarian organizations, but strict travel restrictions due to COVID-19 are making the movement of humanitarian assistance very difficult. The World Health Organization has begun an initiative to speed up development of COVID-19 vaccines, treatments, and ensure equal access for all.
Today, WHO is proud to be uniting with many partners to launch the Access to COVID-19 Tools Accelerator, or the ACT Accelerator. This is a landmark collaboration to accelerate the development, production, and equitable distribution of vaccines, diagnostics, and therapeutics for COVID-19.
Authorities and health workers in Liberia are using the experience of the 2014 Ebola outbreak to tackle COVID-19. The government reopened 5 Ebola-era intensive care units across the country after the first coronavirus case was detected in March. The country has so far recorded 101 cases. On April 11th, President George Weah declared a state of emergency and locked down the capital, Monrovia, which accounts for more than 50% of the recorded cases. The government of Kenya is boosting the capacity of medical institutes to test for COVID-19 in order to help curb the spread of the novel coronavirus. Interventions by the government have increased the country's testing capacity from 384 samples per day to 960. Authorities have also increased the monitoring of people to ensure they are obeying safety measures after dozens of people escaped from a quarantine facility last week. Kenya has confirmed 320 COVID-19 cases with 14 deaths. Health experts are warning that the battle against malaria in sub-Saharan Africa, where it already kills hundreds of thousands of people a year, could be set back by 20 years as countries focus resources on containing the coronavirus. Projections by the World Health Organization say that 769,000 people could die of malaria in sub-Saharan Africa this year, as campaigns to combat it are interrupted. The warning came ahead of World Malaria Day on April 25th. The disease remains one of the leading killers in low-income countries. British authorities say 684 people have died from COVID-19 during the last 24 hours, taking the death toll to over 19,000. The country is one of the worst affected by the virus and has been under a national lockdown for 1 month.
In hospital with the virus, 19,506 have now died. That's an increase of 684 fatalities since yesterday.
The United States death toll has surged past 50,000, according to data from the Johns Hopkins University. More than 3,000 deaths occurred in the last 24 hours, while the country has confirmed 870,000 positive patients. This accounts for nearly a third of the world's cases, as the global count exceeded 2.7 million, with more than 192 deaths. To date, the U.S. is the worst hit in terms of caseload and fatalities. Authorities closed all entrances to a Palestinian refugee camp in eastern Lebanon on Friday, after 4 more people tested positive for the coronavirus. There are increasing concerns over the spread among the overcrowded refugee camps and the settlements. The 4 people infected are self-isolating as they are not in need of hospitalization. A Palestinian woman was taken to a hospital in Beirut this week and became the first refugee living in a camp in Lebanon to contract the coronavirus, which triggered a round of testing in the camp. Meanwhile, a Palestinian university has unveiled a homemade ventilator as West Bank hospitals brace for a potential wave of coronavirus patients. The device was presented by Al-Quds University a day after being certified for use in Palestinian hospitals.
We, as Al-Quds University, the only Palestinian university in East Jerusalem, we put together all our efforts in order to, in this battle against COVID-19, and we start talking with the engineering school and the medical school at Al-Quds University in order to find out how we can help the community and also beyond.
And initially, probably, we are thinking about producing 500 ventilators in the first 10 days and then increasing that number if needs be.
The streets of China's main cities are slowly returning to normal after spending nearly 3 months empty due to the COVID-19 pandemic. But it is taking place under strict control measures to prevent a resurgence of the virus.
Workers, students, and everyday citizens are carefully restarting their daily activities after what many see as a successful battle against the novel coronavirus.
I have left my house almost every day to work and to buy groceries. I feel the city is more alive each day. We're still maintaining protection measures like wearing face masks, taking our temperature, and maintaining social distance.
Beijing, the capital of China, is slowly recovering its fast pace. People are now able to walk freely, do exercise, or simply enjoy the spring.
We are still aware of prevention measures to control the virus, but we can go out, take a walk, exercise. Here in my phone I have the QR code that allows us to show we are healthy. We can move around without the fear of being contagious. That is something no other country has at the moment.
But a return to normalcy comes hand in hand with new restrictions and security measures, most of which have been well received by the people.
We have to use masks all the time and be mindful of washing our hands. Our temperature is being taken almost everywhere. But these are measures that are meant to prevent a worse situation.
After 3 months of a strict quarantine to stop the spread of the disease, authorities are being very careful with a return to normal activities and are insistent in maintaining such measures for the time being.
And with that, we end our news brief. But you can find these and more stories by checking our website, telesurenglish.net. And if you can, stay home and stay safe. For Telesur English, I'm Carla Gonzalez. Until next time.